So this video is going to be about ER versus urgent care. Do you know the difference? Which one can refuse care? Which one do you have to have insurance to go to? What kind of services are you not likely to get at urgent care that you'll get at the ER? What kind of staff is likely to work at the urgent care? Have you ever thought about these questions? Well, I'm going to talk a little bit about those in this video. I am a registered nurse. I worked in the ER for 14 years. Recently just retired 2 years ago, almost 3 now, due to my own medical condition. I keep my license current just because I worked too hard to get it, so I'm not going to let it expire. Now, with the ER, they fall under the EMTALA law, which was passed in 1986, which says basically what EMTALA stands for is the Emergency Medical Treatment and Labor Act. And what that law says is any hospital that receives Medicare funds, which is all of them, if they have a emergency room, then that falls under that. And they have to treat you. They have to provide a medical screening exam to anybody who presents to the ER for any reason, any complaint. They have to screen them and stabilize them regardless of their ability to pay. That's the law. So they have to do that. And so that's why the ERs are so inundated with patients most of the time. That's why the waits are so long, and that's just the way it is. So since 1986 that law was passed, and that's the ER. Okay, so they're obligated. They cannot turn you away, whether you have money or not, insurance or not. That's the law. And the urgent care is different. Urgent care you're usually assigned to. Your insurance will usually say, okay, you can go to this urgent care, that urgent care, and they can refuse you. You can walk up to an urgent care and they say, okay, what's your insurance? If you have none, they say, well, I'm sorry. You know, either you can pay cash or, sorry, you have to leave. You can go to the emergency room. That's where they'll send you. But they can refuse care. That's how their system is. It's different. They don't have to see you. Okay, so that's the first thing. And with urgent cares, it's different. They don't provide every service. Some of them are a little more advanced, but not all of them. Urgent cares often, some of them will not even do stitches. We've had many patients that were sent to us for stitches. A lot of them aren't even equipped to do x-rays or CAT scans. Some of them don't even do EKGs. I've had many urgent cares where we had patients come in by ambulance that were sent over. The urgent care will call an ambulance to send somebody in to the ER. Go figure. And there are many urgent cares that are staffed not even by an MD, but by a nurse practitioner, which is one step up from an RN. Because RNs, you have your RN level, and then you have nurse practitioner, which is the next step. Then you have PAs, which are physician assistants, and then you go MD. So a lot of times there's not even a medical doctor on staff at urgent cares. So it's good to know what you're dealing with. So I had a person one time who needed stitches, and they were concerned about going to the emergency room because they were in between jobs and their insurance hadn't started yet. So they were concerned about the bill, and they didn't want to go, and which is a big mistake, because emergency rooms also do have different plans that they can work with you financially. If you're low income, so they will work with people too to pay the bill. So it's not going to always be this huge exorbitant bill. So they will work with people. They'll even help people get on Medi-Cal if they need to. So, you know, it's like if you need treatment, it's better to go and get the treatment that you need if you really need treatment than to avoid it and end up with later a bigger, huger problem than to avoid medical treatment. So they do have things. They'll work with people. They'll help people to apply for Medi-Cal and things like that, than to sit home and suffer and end up with like a huge nasty infection from something that you didn't get fixed when you could have got it fixed easier, than to let something get infected and then you end up with a bigger problem and you end up septic later. So don't avoid getting treatment if you need it. It's better to get looked at. But those are the main differences between the two. So a lot of people don't really know that, because if you've always had insurance, you never thought about it. So that's the big difference between ER and urgent care. And the other thing is, when you go into the ER, many ERs now have a fast track area and the main area. So when you come in and let's say you've got a cut, usually the triage nurse, that's what I used to do, I love doing that, is we'll look at what you got and decide, okay, do you need to go to the main part? Like if you come in with chest pain or stroke symptoms, okay, you're going to stay in the main side. If you come in with a cut and it's simple, we're going to send you over to the fast track area or our rapid area, depending whatever they're calling it. Some people call it fast track, some call it a rapid area, whatever. Every hospital is calling it something different now. We called it fast track. So depending on what it is, you'll go to a different area. And so you'll get seen maybe a little quicker, and then those areas are open like during certain times when they think more of those things will come in. So there's that too. So not necessarily that you'll be waiting a longer time or whatever, but either way, when you go to the ER, you can expect that you're going to be there for a while, just because it is, because of course more serious things take up more time and then take up more resources, because you know, when we have patients come in that are more serious, it takes up more staff, and that's what people don't realize a lot of times. If we have a code, of course it takes more of the staff, so then those resources are diverted, then there's less staff. And the one big thing a lot of people don't realize is that, especially when you come in at late at night, that ER doctor is the one doctor, if there's a code in the hospital, late at night especially, or anytime really, that ER doctor is the one, when there's a code, somebody dies on the floor, he's the one who goes up to that code. When there's a code blue in the hospital, usually it happens at night. I mean, I was always night shift, so when the code blue went off at night, that ER doctor, and he's like usually only one on duty overnight, because we cut down to one doc in the middle of the night, he's the one who goes up for the code blue. So then that ER doctor is taking care of all the ER patients, everything stops. He has to go up for the code on the floor in the hospital and deal with that code. So guess who's running the ER? The ER nurses are maintaining the ER patients while the ER doctor is up there dealing with the code. The ICU nurses are up there in the rapid response team with the ER doctor, but the ER nurses are running the rest of the patients, dealing with the patients. Now if anything comes in through the ambulances, we're taking care of that too, and we're dealing with that while the ER doctor is upstairs. So usually he's not up there long, but sometimes he was. So that's how ERs function, and that's how it was for a long time. I don't know if they've changed it now. I've been gone for a couple of years, but that's how we ran it. Okay, so for the last 7 years that I was there at my ER, that's how it ran. And when the codes happened at night, our ER doc was gone. He was up there, dealt with the code, and that's how they ran the hospital. And I know a lot of hospitals ran like that, because after midnight, it was down to one doc in that ER. So just so you know, that's pretty much how it goes. And ERs, they can get busy. Sometimes they would slow down between like maybe 3 and 5 for a little bit, but a lot of nights they didn't. So, and I would imagine it's pretty crazy now with all the hysteria. So just a little clue so you understand kind of what's going on. And you know, we take patients in by severity, do the best we can, and you know, everybody feels they're the sickest, of course, but that's not how we triage. We triage by you know, what's actually, you know, how the nurse determines what's the sickest. So, of course, heart attacks, strokes, things like that got to go first. So, hope this information is helpful to you. And I'm going to be making more videos. Some of them are going to be kind of interesting. I'm going to tell you about some of the silliness that I've seen. It's going to be interesting. All right. Bye.